Hi everyone, this is the What Is video series. Welcome! Today we're going to discuss what is Helicobacter pylori. Now, to start with, it's a bacteria. No brainer there. And before we go on, just a reminder that you can subscribe to our channel to support us. And if you like the content, of course, give us a thumbs up. Thank you, and let's get started. Oh, and one last thing. This video is definitely longer, but you can click on the link below and it will take you just to the summary that it takes 1 minute. So in just 1 minute, you have a basic knowledge of what this bacteria is. So let's get started. So it's a bacteria, yes, and these germs can enter your body and live in your digestive tract. After many years, they can cause sores called ulcers in the lining of your stomach or the upper part of your small intestine. For some people, an infection can lead to stomach cancer. Getting this bacteria is not totally uncommon. Actually, it's the opposite. 2/3 of the population has it in their bodies. And for most people, they don't cause ulcers or any other symptoms. However, if it does cause you problems, then there are medicines to kill the bacteria. For decades, doctors thought that people got ulcers from stress, spicy foods, smoking, and other lifestyle habits, right? But when the scientists discovered this bacteria in 1982, they found that the germs were the cause for most stomach ulcers. So when the bacteria enters your body, it attacks the lining of your stomach, which usually protects you from the acid your body uses to digest the food. When this bacteria has done enough damage, the acid can get through that lining and leads that to ulcers. This may bleed, cause infections, or keep food from moving through the digestive tract. So where you can get this bacteria? Well, from food, water, or utensils. It is more common, however, in countries or communities that lack clean water or a good sewage system. And you can also pick it up from somebody else with the saliva or other body fluids of infected people. Many people get pylori during childhood, but adults can get it too. Actually, I do have it right now. I'm going under treatment. The germs live in the body for years before symptoms start, but most people who have it will never get ulcers. So doctors aren't sure why only some people get ulcers after an infection. So what are the symptoms that you may possibly have? Well, if you have an ulcer, you may feel a dull or burning pain in your belly. It may come and go, but you'll probably feel it most when your stomach is empty. So between meals, right? Now, it can last for a few minutes or it may be for hours. You may feel better after you eat or drink milk or take an antiacid. Other symptoms or signs that you have an ulcer would be bloating, burping, not feeling hungry, or nausea, vomiting, weight loss for no clear reason. The thing about ulcers is that they can bleed into your stomach or intestines, which can be dangerous to your health. Get medical help right away if you have any of those symptoms, like a stool that is bloody, dark red or black, trouble breathing, dizziness, feeling very tired, pale skin color, vomit that has blood, or severe sharp stomach pain. At the first stage is also you may have heartburn, and the way to diagnose this is by doing a test blood and sometimes a stool also test to find out whether it's this bacteria. Treatment, it takes usually 1 to 2 weeks to get better. You will need to kill the germs, of course, heal the stomach lining, and keep the sores from coming back. And undergoing this treatment could mean that you would be taking like 10, 12, or 14 pills per day, right? For a few weeks. I'm currently on 10 actually. But it's really important to take everything that your doctor prescribed and follow their instructions. So now you may be wondering, how do I prevent getting this bacteria? Well, washing your hands, no brainer there. Every time you use the bathroom or before you prepare or eat food, avoiding the food or water that is not clean, don't eat in anything that isn't cooked thoroughly, and well, it's basically that, hygienic. So let's recap. This pylori bacteria is a germ that can enter your body and live in your digestive tract. Now, after so many years, it can cause these ulcers, these sores in your lining of the stomach, so that it causes you an infection that may lead to cancer, stomach cancer. If you have an ulcer, you will find out because you will be feeling this dull and burning pain in your belly. It may come and go, it may last a few minutes or for a whole hour, but in any case, it happens between meals. And you may want to feel better by eating, drinking milk, or even taking antiacids. The way to treat it, it's 14 pills or more, sometimes a bit less. I'm on 10 myself, and going through treatment for at least a few weeks. Hope you liked this video and found it very informative. In any case, always talk to your doctor.